I notice you utilize a lot of different terminology when it comes to everything. What was your reasoning behind this?
There is such a stigma around Alzheimer's and dementia that even the terminology affects people in ways that leaves them feeling overwhelmed, hopeless, and reluctant to talk to a doctor, even if they have obvious cognitive impairment, because they just don't want to know, let alone talk about it.
Well, it is a scary thing to think about.
The only way to reach everyone was to alleviate the anxiety around all of it. So our number one priority was to come up with simple but effective and memorable ways to label things.
How did you approach this?
For example, we now know that beta amyloid and tau levels are the key biomarkers for Alzheimer's risk. And when you start explaining this to patients, you immediately see eyes glazing over and they just tune out.
Interesting.
So we came up with BAT levels to simplify understanding, and lo and behold, it was a much easier way to explain things.
It is.
The higher your BAT levels are, the higher your risk for developing Alzheimer's. See how much less intimidating things become with a simple rebranding?
Interesting.
Then you compare this to something that most people understand. Like having high BAT levels is like having high cholesterol or blood sugar. The higher your cholesterol levels are, the higher risk of developing heart disease, and same with blood sugar leading to diabetes. Now, it's way more approachable and easier to understand, right?
Oh my goodness, so much less intimidating.
Funny how that works. So we ran with this and began applying this terminology to simplify everything.